Dumelang Mzansi, Sanbonani. I'm Clement Manyatela, and this is the Health Club. Today, we'll be talking about aging and chronic illness, managing long-term conditions. We're also talking about healthcare and disability rights, ensuring fair access to medical services. If you're a caregiver, a parent, or a young person living at home with ukoko or umalume, this episode is also for you, because taking care of our elders and loved ones, those living with disability, is not just a responsibility, it's a privilege. We're asking, how do we age with dignity? How do we make sure disability doesn't mean invisibility? And how can we all do our part? It's all going to be unpacked in our episode today. So it's best to stay tuned, call on your friends and your family, because this is what's coming up.
In terms of people that specialize in geriatric care, there are about 18 doctors in South Africa that do that.
Take care of the elderly, the sick, the disabled, and children.
Arthritis, high blood, swigiri.
That's just a taste of what's coming up. As young people, families, and even organizations, we need to be more intentional about understanding what services are actually available, especially through medical schemes like GEMS. Knowledge can be a lifeline, particularly when you're caring for someone older or those living with a disability. Because as we age, healthcare isn't just a nice to have, it becomes essential. And yet so many elders don't know what they're entitled to or how to access it. So we went to the streets to find out what they have to say about aging, support, and the challenges of navigating medical aid. Take a look.
As I'm working with the community, let me just respond especially to the community. The most problems that the community face or our elderly people face in their, let me say, the community health services, not private, but the community health, the public ones, is the management of our health systems in a way of lot of queues, long queues. They wait for long hours outside before the facility can be open. And also the experience, the communication, which is a problem in the health system. You find out an adult is speaking maybe Setswana, for instance. So it won't be easy for her to communicate to somebody that is speaking Zulu. So, or somebody is addressing them in English, and it's difficult for them to answer the questions in English. So language barrier, sometimes it becomes a difficult, it's a problem in one of the facilities. And also the time frame the facilities are operating. Most of the public clinics are operating from 8 to 4. That actually makes them to feel like they are pressured to go the early hours of the morning. By 6 o'clock, they are on the queue, so that by 8, when the facility open, they'll be at most number 1. So there's no priority when it comes to other people.
Bona bayazama ukusitha kahle, kodwa kudla ukuthi izinsiza kusebenza zikho. Uthola ukuthi nabo futhi babanele. Manje kuloko kwenza kube ne delay.
Ngoba ke ngithatha sentulwa langazo. Akhiwa bona khona utsamana. Arthritis, high blood, swigiri.
Shortage of staff, so we don't have enough staff management in the clinics. So bakazama hore at least ba get staff sabone, especially in the early hours of the morning, because of the elder people are coming early hours of the morning, and also to make sure that we have facilities that can run 24 hours for a person that is working to not miss work just because he have to go and collect a repeat yakhe, and the person can go on a convenient time.
Bothatha ke line, heli fika le tshwantse le eme line e telle, heli tloga le ya mo le tsena mo le tswa mo le tsena mo le tswa ke yona problem ya teng.
Thina njengabantu abadala nje ngabe ngcono uma kuthiwa noma ikublasiye khona kuba nohlelo ukuthi abantu abadala babe bodwa bangaxubani nabantu abasebasha ukuze ukuthi abantu abadala basizwe kuqala, ngoba kuthina ayikho okumnandi nje uma kumiwe nje kanje konke kubhlungu, yabo. Yeah, nokuthi-ke manje kakhulukazi ey'bhedlela nasemaklinikhi i-medication iyashoda.
What is the affordable amount for an ordinary community member? It can range from 150 to 250. A normal person, a person that is not any much can afford that amount without being inconvenienced in a budget, you know. So 150 to 200 is an affordable amount for somebody that is not earning that much.
Ungcono wazothatha 200 rand ngenyanga.
Welcome back to the Health Club. Today we're focusing on the people who've paved the way for us, our elders. We're diving deeper into what aging means in South Africa and how we can better care for those who raised us. Joining us now is someone who understands this world intimately, Dr. Tasneem Bucks, a physician who specializes in geriatric care. Dr. Bucks, thank you so much for joining us.
Thank you for having me.
Let's start by understanding the big picture stuff. What are some of the most common health concerns that are facing older adults in South Africa?
Sure, so there are several. Older adults tend to suffer more from non-communicable diseases such as hypertension, diabetes. There are also certain cancers that are more prevalent in the elderly. The elderly face a loss of independence and function. And there are also certain mental health and neuropsychiatric issues that come with aging.
And then when we talk about access to healthcare, how does access or lack thereof, even of medical aid and consistent care, affect the overall health of the elderly?
So in terms of people that specialize in geriatric care, there are about 18 doctors in South Africa that do that.
Only 18?
Only 18. In Johannesburg, 4 of them are in the private sector and 2 are in the public sector. So just based on that already, you can see that access to specialized geriatric care is very limited.
Why is it important to have people who specialize? Help us understand the kind of care that they offer through their speciality, as opposed to when you go to a general doctor or any ordinary nurse.
Yeah, sure. So in geriatric care, we look at what we call the 5 M's. And these are mobility. As I said, there is some sort of disability that comes with aging, loss of independence and loss of function. It looks at the mind. So mental issues are obviously common in the elderly, especially things like delirium, dementia, as well as some psychiatric issues such as depression and anxiety. We also look at medication. So as you age and you accumulate chronic conditions, you also accumulate medications. And so we also look at whether these medications are prescribed for the correct indication at the correct dose, and what adverse events that the elderly may be experiencing with these medications.
Yeah, it's interesting then, because then aging isn't just physical, right? It's social, it's emotional as well. What role does mental well-being play in elderly care, and are we doing enough to address it?
So I think it plays a very big role in elderly care. One, because as you acquire these multiple comorbidities and you lose independence and you lose function, it's very difficult for the elderly person who may have previously been extremely independent to admit that they need help, and that they require escalating levels of care, for example, that they can't live alone anymore. And it leads to a lot of depression and a lot of anxiety in the elderly.
How do we support them then? There are people watching us who've got the elderly in their households. What are those small but critical things that caregivers at home can do to better support the elders?
So one is we should listen more to the older people, find out one of the 5 M's, what matters most. What matters most to that older person, how they would like to see their latter years proceeding, and what we can do in the home and even outside the home in terms of social activity in order to help the elderly achieve these goals. How we can modify the structure of the home. So for example, grab rails, maybe putting a stool in the shower, so that we can make these little activities that everyone has to do every day a little bit easier for the elderly, so that they don't feel as though they've entirely lost their independence and they can still contribute to things for themselves and little things around the house.
Let's talk about prevention now. Are there specific screenings, maybe checkups that are necessary for the elderly, or lifestyle shifts that you'd recommend?
So aging well actually probably starts when you're young. So for the best thing you can sort of do in your early life is get educated. So that is actually preventative for some of the conditions that we look at, specifically dementia. The other things are don't smoke, don't consume alcohol excessively, make sure that you get your hearing checked. That is a big factor in terms of a preventable thing that may lead to a dementia in an elderly person, especially because when you lose your hearing, and even when you lose your vision, you sort of lose contact with the world. You know, and that leads to miscommunications, misunderstanding, and losing out on a lot of important parts of the day.
Yeah, so that's very important. In your professional view, though, how can medical aid schemes evolve to serve the elderly better?
You know, so most of our elderly, especially in South Africa, are probably actually not on medical aid. Or once they go into retirement and, you know, are living on a lesser income, they're unable to afford perhaps the same plan, so they downscale their plans. So I feel like medical aids really should look at all their levels of plans holistically and try and especially the lower ones, which probably more of our elderly patients are likely to afford, to try and see that they can encompass more geriatric care and more geriatric screening.
What's your advice to those who are considering that, oh, do I want to downsize, do I want to opt out of medical aid?
I would always recommend to someone who has the privilege of having a medical aid, as far as possible, if you can, you know, cut out other things in your life rather than your medical aid. Try and stay on a medical aid. So if it means that in order to stay on a medical aid you must downgrade your plan, then unfortunately that is what you must do. But it's just that currently I don't know that the public sector has the capacity to handle all the patients that it sees. And that's the one benefit of having a medical aid, is the sort of access and the speed at which you can get attention.
Absolutely. Dr. Bucks, thank you so much for joining us.
Thank you for having me.
Now, it's clear that caring for our elders takes more than just medicine. It takes time, empathy, and support systems that understand the unique challenges of aging. Up next, we turn the lens to the people often holding it all together, the caregivers. What is their experience? What do they carry emotionally, physically, and even financially? Let's take a look.
My name is Vivian. I'm 30 years old. I work at the School of Kenya. I'm a trainer, course trainer, and also I'm trained as a caregiver. And I'm a mother of 2 boys. We take care of the elderly, the sick, the disabled, and children. So basically we help them. We are not nurses. We help them in feeding, bathing the patient, making sure they take their medication on time. I think caregiving chose me before I became a caregiver. My grandmother had a stroke. So I said to my mom, can I help? And then she was like, yeah, you know, she's an older woman and you're young. You know, our culture as well, they'll think that is bad luck and stuff. But this is my grandmother. And I said, I'll do that. So we went for checkups, and we go to the hospital. I'll ask the doctors and the nurses, how can I do this? How can I help to bath her? Because she was big and I was a bit smaller. So how can you help me with the techniques? So one lady said to me, why don't you do caregiving? They are going to train you on how to take care of your grandmother. So I asked my mom, and my mom was like, no, this is too much. And I'm like, I want to do it. I love people. So I wanted to be there for not only for my grandmother, because when we go to the hospitals, we can see that there are so many people who need someone to be there. So many people to help with bathing. So many people need help with feeding. Some of our patients can't eat on their own. You know, death is not a nice thing to talk about or to think about, even for us caregivers and those who are going through death. You know, you have to allow yourself, allow the emotions. They are mixed. You feel sad, you cry. Also, just like us as caregivers, we also feel those emotions because we are connected to the people that we look after. So also to seek also guidance, professional help, to talk. You know, talking also sometimes helps. You know, express how you're feeling. You know, you talk. When you talk, you are releasing exactly what you're feeling. You can also get help from other people or get encouraging words. You know, people, when you reach out to people, you also get help. So a person, before they train, they have to ask themselves, will I be a good caregiver?
That's a lot to reflect on, and we're not done yet. After the break, we'll look at how we can all play a role in creating safer, more supportive environments for persons with disabilities. Don't go anywhere. Welcome back to the Health Club. Earlier, we explored the challenges facing the elderly and those who care for them. But there's another group whose needs are often overlooked in the healthcare conversations. Persons with disabilities. From physical access to specialized treatment and long-term care, the journey isn't always simple and the system isn't always ready. To help us understand these realities, I'm joined now by Dylan Mashele, a passionate advocate for disability rights and integrated healthcare. Dylan, thank you so much for joining us.
Good afternoon, Clement, and to the viewers.
Let's start with just your own personal experiences and from what you've been able to observe, because you are an advocate of disability rights. When it comes to accessing quality medical care, what's been your experience?
To be quite honest to you, Clement, it has been not an easy journey as a person with a disability. The medical sector on its own is not conducive when it comes to persons with disabilities. I am a person with a low vision, and it's quite difficult sometimes to access. It's not inclusive for persons with low visions. One, reasonable accommodation, it's not practiced towards persons with disabilities in the sector. So it is quite difficult.
Are we seeing it change with medical aids? Are they becoming more inclusive? Are they hearing what the persons with disabilities and what their concerns are?
Yes, with the medical aids and the digital world that we are converting into, things are getting there.
Well, in your experience and the people you often work with, what are some of the challenges day to day that you face as persons with disabilities?
We face a lot of challenges as persons with disabilities. One, the biggest challenges that we face is the environment not being accessible. The second one, it's the attitude of people.
Yeah.
And then the third, it's communication. How people communicate with persons with disabilities.
Yeah.
It's the biggest challenge that we face.
Yeah.
You often go to a public space, and as a person with disabilities, people don't talk to you about things that concern you. They talk to people that are next to you or you are with.
Yeah. And how do we change those perceptions? How do we change even those behaviors? Because there's always awareness. You work for an organization that advocates for persons and the rights of persons with disabilities. But how do we get societies to understand that that's not how you treat persons with disabilities just because they're differently abled?
You know, the organization that I work for create awareness by different projects that we're having. There's a project called DET, which is Disability Equity Training. It's a system where it instills sense of pride to persons with disabilities. It sensitizes the communities, the sectors about reasonable accommodation for persons with disabilities.
And economically, what do you think government needs to do? How can government show that it also, I mean, we do have a department of women and children and persons with disabilities, but what is it that they need to do to show that there's care and there's intention to also impact the lives of persons with disabilities?
We believe in self-representation. if I can represent the partially sighted or the low vision people, I will speak from experience. I won't assume that all of them, they require a certain type of a font size. I would know that there's B1, which are totally blind people, B2 that are partially sighted people, and B3. I will make sure that I cater and accommodate all the categories as compared to someone who doesn't know about the challenges that persons with low vision face on a daily basis.
Yeah. For some people watching us who may have a disability and they've just been discouraged by the behaviors of communities, whether when they're at work, maybe when they're out in the streets, what advice do you have for them? Any words of encouragement to someone watching us and saying, I can relate to what you're saying, Dylan, but as soon as I step out of this house, it's just so difficult to be integrated in those systems?
It goes back to us again. If I want reasonable accommodation from you, I don't have to be rude to you. I need to educate you. I need to hold your hand and tell you that it's not persons living with disabilities, but it's persons with disabilities.
Yeah. Is there one thing you've always wanted able-bodied people, so to speak, to know about or knew about, people who are or persons with disabilities? What's that one thing?
They should never take decisions that will impact me, about me, without my consent. They should consult me. And if there's something that people don't understand about me, rather ask me than trying to assist me.
Dylan, thank you so much for sharing your story with us.
It's an absolute pleasure.
Now, supporting people with disabilities requires more than just care. It takes compassion, planning, and access to the right resources. It's about creating a healthcare system that leaves no one behind. Medical schemes like GEMS are stepping up to meet that challenge with services designed to support vulnerable communities, from the elderly to people with disabilities, with dignity and respect. Let's take a look now at what's new. Here's your GEMS news update for the week.
This edition of GEMS News, we highlight healthcare support available for people living with disabilities and elders. People with disabilities and the elderly population often require unique healthcare, suitable facilities, and essential support services. GEMS aims to ensure equitable access to quality healthcare, support, and accessible medical services. Through tailored benefits and specialized support networks and programs such as our Alternative to Hospitalization program, we strive to improve the health and quality of life for these members. Knowing about and accessing these resources can make a significant difference. For more information about GEMS, visit our website or contact us through our social media channels.
Thank you for joining us. Today was a reminder that healthcare isn't just about treatment. It's about care, dignity, and community. Whether you're caring for a parent, a person with disability, or you're planning ahead, knowledge is power and support is out there. Hlalani ninempilo. Re a leboga. See you next time here on the Health Club.